with some silver paint.
Jessica Watson has been taking her son Brady to the Shriners Hospital for Children in Greenville, South Carolina since he was a baby.
They all run up to Ozzy. And
she credits the hospital, which charges her nothing, with helping Brady live to celebrate his 5th birthday.
When Brady was first born, he couldn't open his hand. Now, on a good day, Brady can open his fingers with the braces. Also, Brady's legs was also messed up. He was really stiff and really couldn't move. But what Shriners has done, they have gave me the resources and the abilities to help me get his feet better.
This is a charitable hospital that covers all patients' costs, including surgery, physical therapy, and medicine, paying for the services from their investments. But now, thanks to the economic downturn and losses on those investments, the group that runs Greenville says it might have to close 6 out of its 22 hospitals, including this one.
I just know there's going to be a number of children that are not going to be treated, and that's sad. And then there's going to be other kids that are going to get treatment, but they're not going to get treatment to the level they could if they got it at our hospital.
The prospect the Greenville hospital could close terrifies parents.
We do have insurance, but we just didn't have the money to send him to orthopedic doctor because you got your deductible and you got to pay that, and we live from check to check already.
The Shriners dilemma is just one example of how the patchwork approach to health care coverage in the U.S. is fraying. About 59% of Americans get their health insurance through their jobs, but that percentage is falling because companies are either laying off workers or dropping their plans due to the rising cost. Another 9% buy their insurance directly, but it's expensive. And only the elderly and the very poor get a basic amount of insurance paid for by the government. That leaves nearly 46 million Americans without any health insurance. And experts say millions more don't have enough insurance to cover their families' needs. So much of President Obama's drive to reform the U.S. healthcare system focuses on the need to control costs. But healthcare experts say it's not getting everyone to agree that the system needs to be fixed. It's trying to figure out just how deeply involved the U.S. government should be in running it. More than 3 months into his term, Obama has set aside about $640 billion in next year's budget to help pay for reform. But he hasn't said what that reform would look like.
Let's just try it on real quick, okay?
Past attempts to make changes have failed because insurance companies, hospitals, and doctors have blocked any limits on how much they can charge patients for services.
I think President Obama is probably a great man, but he needs to come down to South Carolina, see our children, see what we need. Talk is wonderful, but he needs to stand up for our children.
Patients' orders to those in charge of trying to make health care in the U.S. affordable and available to all. Rosiland Jordan, Al Jazeera, Greenville, South Carolina.